Good morning, Rotarians. I am honored today to introduce Dr. Tunji Funsho. Dr. Funsho is a member of the Rotary Club of Lekki, Nigeria, past District Governor of District 9110, and Chair of Rotary International's Polio Eradication Program in Nigeria. In 2020, Dr. Funsho was named one of Time's 100 most influential people in the world for his leadership in efforts to achieve eradication of wild polio in the African region. We look forward to learning more about where we are today and what it will take to finish the job of total eradication of polio.
Thank you very much for having me in your PETS. It's a real great opportunity to share my experience and that of other Rotarians, both in Africa and around the world, in our collective effort to ensure that no child ever again is paralyzed by the wild polio virus. I have made, just in case there's failure of internet connection, I have made a video which I hope can now be screened.
Thank you for inviting me to this very important seminar. It's a delight for me to be here to talk on a subject that is dear to my heart, and I'm sure to the heart of most Rotarians across the world. That is our promise to the children of the world for a polio-free world. Progress in polio eradication continues, and we must build on our progress to ensure we reach our goal of a polio-free world. During this presentation, I'll provide an update on the status of polio eradication efforts, share information on the new vaccine that is being used, and give highlights of the new strategic plan to end polio for good. After that, I'll talk about Rotary's role in the global effort and what we all can do to ensure that we really realize our dream of a polio-free world. In 1988, there were 350,000 cases of polio in 125 countries. Today, only 2 countries, Afghanistan and Pakistan, continue to report cases of epidemic wild polio virus. Most compelling is that because of our efforts and those of our partners, 20 million people are working today who will otherwise have been paralyzed by the polio virus. Another major result of our effort was the certification of the African region of WHO as wild polio virus free in August 2020. That means that 5 out of 6 WHO regions have been certified polio free, and 90% of the world live in polio free regions. My own country, Nigeria, was the last country to report endemic polio in the region. The numbers on the slide show the magnitude of the progress in Africa, and that is thanks to Rotary. But we must not be complacent. We must sustain high population immunity and sustain sensitive surveillance until we reach our goal of the polio-free world. Now, I have some very recent news. As a result of ongoing disease surveillance, the Global Polio Eradication Initiative, GPEI, has confirmed the case of wild poliovirus 1 in Malawi, in a child suffering from paralytic polio. Analysis shows that the virus is genetically linked to the wild poliovirus 1 that has circulated in the same province of Afghanistan. GPEI is supporting health authorities in Malawi to conduct a thorough assessment of the situation and begin urgent immunization activities to mitigate any risk of spread. Environmental surveillance measures are also being expanded in Malawi and neighboring countries to detect any other potential cases. Detection of wild poliovirus 1 outside the world's 2 remaining endemic countries of Pakistan and Afghanistan is a serious concern and underscores the importance of prioritizing polio immunization activities in countries such as Malawi to prevent future instances of importation. Rotary has continued strong financial support to Africa since the most recent previous case in Nigeria. During the last 2 years, 54% of Rotary's Polio Plus budget has supported disease surveillance, outbreak response, the purchase of vaccines, and operational expenses throughout Africa. While the news from Malawi was sad and disappointing, the polio program has seen importations from endemic countries to regions that have been certified wild polio virus free in the past, and has moved quickly to successfully stop transmission of the virus in those areas. An estimated imported case from Pakistan, this detection of wild polio virus 1 in Malawi does not affect the WHO's Africa region's wild polio free certification status. Africa still remains certified as wild polio free. This clearly demonstrates that polio is only a plane ride away. The slide illustrates the dramatic decline in polio cases over the last year. In 2021, only 6 cases of wild polio virus were reported. 1 in Pakistan, 4 in Afghanistan, and 1 imported case into Malawi, as I just reported. Now is the time to be extra vigilant and redouble our efforts to build on the progress being made with a strong effort to reach those children who are missed with the polio vaccines due to conflict because they live in remote areas or are nomadic. We are tracking a strain of the polio virus called the circulating mutant virus. This occurs when the weakened strain of the polio virus used in the oral polio vaccine circulates among under-immunized or suboptimally immunized communities for a long period of time and can revert to a form of polio that can cause paralysis. The most prevalent circulating vaccine-derived poliovirus is the type 2 virus. A new vaccine called the novel oral polio vaccine type 2 or NOPV has been developed to respond to these outbreaks. While there are fewer cases of the variant strain in 2021 compared to 2020, that's 43% fewer, they far outnumber cases caused by the wild poliovirus. In June 2021, the Global Polio Eradication Initiative, of which Rotary is a founding member, launched a new strategic plan covering the years 2022 to 2026. The new plan builds on our progress to date and addresses the remaining hurdles to polio eradication. The title of the strategy is, as you've guessed, delivering on our promise. The strategy has 2 goals. The first goal is to interrupt transmission of all polio virus in Afghanistan and Pakistan, which are currently endemic countries. And the second is to stop transmission of circulating vaccine-derived poliovirus 2 outside the endemic countries and prevent outbreaks in already polio-free regions. The new strategy amplifies support to countries at high risk of polio, including by enhancing disease surveillance, integrating polio services with other health initiatives and routine immunization programs, and improving outbreak response, speed, and quality. We are confident that with this strategy, we will deliver our promise to children everywhere that they will soon live in a world free of the threat of polio. This strategy, similar to strategies in the past, requires us to reach up to 400 million children per year to sustain high levels of immunity, which requires hundreds of thousands of frontline workers going door to door, house to house, market to market, looking for all children under the age of 5 to vaccinate multiple times in a year. In addition, disease surveillance activities must intensify by looking for the virus in children and the environment, as the polio virus can live for a short period of time in sewage water. This surveillance system is necessary to determine if and where the polio virus is circulating and will be used to determine when polio virus circulation has been stopped. Rotary's main role in achieving a polio-free world is fundraising, advocacy, and raising awareness through the engagement of our membership. The End Polio Now fundraising campaign is our effort to raise $50 million per year. That is matched 2 to 1 by the Bill and Melinda Gates Foundation. This means that each year that Rotary commits $50 million to polio eradication efforts, the Gates Foundation will contribute $100 million to Rotary's Polio Plus program, resulting in a total investment of $150 million for polio eradication efforts. Clubs are encouraged to contribute $1,500 and the districts are encouraged to contribute 20% of the district's designated fund EDF, which is matched 50 cents to the dollar. This pie chart shows how donations to Polio Plus were used in 2021. Donations to Polio Plus are primarily granted to the World Health Organization and UNICEF, the two implementing partners in the GPAI, that is the Global Polio Eradication Initiative. The majority of funds are spent on vaccines and getting vaccines into the mouths of children, and that includes our cold chain system. We also provide funding for activities that raise awareness in communities about when vaccinations will take place and the benefits of polio immunization and the disease detection system referenced earlier. A small portion of grant funds are used to secure the technical experts at the country, regional, and global level needed to guide polio eradication efforts and to research to facilitate progress in polio eradication. Another important aspect of Rotary work in advocacy with donor governments such as Germany, United Kingdom, United States, Japan, Canada, Australia, and others that also provide critical funding to the Global Polio Eradication Initiative. This is a photo that includes past Rotary Foundation Chair Ravi Ravindran, who represented Rotary at the Global Polio Eradication Initiative pledging moment in Abu Dhabi in 2019. During that event, past trustee Chair Ravindran and the Rotary delegation had multiple bilateral meetings with donor representatives to thank them for their pledges and to encourage continuous support. In addition, Rotary advocates with polio-affected countries to encourage them to prioritize polio eradication efforts, conduct high-quality polio campaign, and express Rotary's support for their efforts. Here, past Arab President of the NAC meets with Prime Minister Imran Khan of Pakistan during a visit. These high-level visits are essential to sustain momentum for polio eradication, recognize the work of governments that the governments are doing, and encourage accountability and ownership. Recent modeling in 2019 attests eradicating polio will generate $14 million in expected cumulative cost savings by 2050, when compared with the cost countries will incur for controlling the virus indefinitely. There's a big difference between control of a disease and eradication of a disease. There are still a lot of diseases that we are in the control phase. Our promise to the world is eradication of polio. That is total removal of the polio virus from every environment across the world. In financial terms, the global effort to eradicate polio has already saved more than $17 billion in health costs since 1988, resulting in an anticipated saving of $41 billion. President-elect Jennifer, through her team for the year, joined us to imagine Rotary. And Rotary imagines a polio-free world. And the impact of the cost saving of a polio-free world on health systems, especially in Africa, can not be underestimated. The next 3 slides shows what $1 million can buy in Africa for health, for improving the healthcare positively of its people. Rotary has contributed $2.4 billion to polio eradication activities. This figure includes $1 billion in matching funds from the Bill and Melinda Gates Foundation. Of that 2.4 billion, 935 million has been directed to the African region. That's approximately 39% of Rotary's total giving being directed to our efforts in Africa. Another important activity for Rotary is raising awareness about our role in global efforts to eradicate polio and the historic opportunity to eradicate only the second human disease in history after smallpox. World Polio Day on 24th of October and World Immunization Week, the last week of April, are great opportunities to showcase Rotary's contribution to polio eradication and encourage continuous global commitment to finish the job. There's a toolkit in the resource section of mPolio Now website that include graphics and sample social media posts that you can use to promote your own World Polio Day events. As the goal of polio-free world nears, it is imperative that we, as the organization that first had the vision of a polio-free world, sustain our commitment and encourage the global community to do the same through our advocacy and awareness-raising activities. Rotary's leadership is more important now than ever, as we need to ensure we reach our fundraising goal of $50 million to fully leverage on the match from the Gates Foundation and provide essential financial resources to the highest priority countries, such that the critical eradication activities continue unabated. This photo says it all. A dedicated frontline worker, a happy and proud mother, and most importantly, a child forever protected from paralysis by the polio virus. This is what our polio plus program is achieving. Our vision of a polio-free world is in sight. And we must deliver on our promise to protect all children from the polio virus. This will only happen with your active engagement and support. Thank you for listening.
Dr. Funsho, thank you for being with us. I think we have time for a couple of questions. And I had the privilege in 2018 to spend World Polio Day in Mombasa, Kenya, at a big World Polio rally down Moi Avenue. It was probably the most inspiring thing I had done in Rotary to date. It just a beautiful experience. As we get into this endgame 23, that is sort of the catchword that is being used a lot, and we approach World Polio Day 2022, any thoughts on some things that individual clubs could do to really promote? We talk a lot about public image, to really promote our connection to Rotary that sometimes gets a little bit lost in all the other names that are connected to this effort.
That's right. I think that's a very, very pertinent question. Everybody loves the winning team. At the beginning of this program, there were lots of skeptics who thought it was too great a job, for Rotary to embark upon, even with the support of WHO and other partners who joined. But we have all seen that it can be done. And as we near, the end, naturally, other people will want to, jump on board so that they can also claim, some of the accolades for polio eradication. And that is why it is very important for us, of all those 4 areas that we are working, we need to sustain our activities. Advocacy is paramount to our governments. There's a lot being done, by Rotary in advocating to the US Congress, and they keep increasing their funding to the Polio Plus program through CDC and USAID, and other governments, like I've mentioned. It is Rotarians who actually are the catalysts that advocate for these governments to remain involved in ensuring that funding becomes available. But then some of the activities that you participated in Kenya, for instance, should be widely publicized so that not only Rotarians, but the public will appreciate our connection with this program until we rid the world of wild polio virus, either in a child or in the environment. But fundraising continues to be very paramount. The longer it takes to eradicate polio, as you've seen in the graph, the more expensive it becomes. And that is why the need to eradicate polio becomes a little bit more urgent now.
Doctor, speaking of the funds that are necessary, that remain to raise to eradicate polio, Charlie McGill has a question about where are we on that $50 million target? Are we just at the beginning, or have we been able to raise some of those funds so far?
Well, I did not check, the latest update. What I can say is that we always surprise ourselves. Remember when we started this program to raise, $120 million in 1985. By the time we came to the convention in Philadelphia in 1987, we had raised almost $240 million. We have always been able to meet our $50 million, commitment mark. And I have no doubt that we'll do the same, but we need to continue encouraging Rotarians. Rotary clubs, are encouraged to contribute at least $1,500 annually to the program. And the districts are also, enjoined to contribute 20% of the DDF, which will be matched by, every dollar will be matched with 5 cents, so that we can get, to this $50 million target. I'm confident we'll get there, but we'll need to continue advocating to Rotarians to ensure that, we get this $50 million in before the end of the Rotary year.
Thank you.
Dr. Funsho, you are certainly one of our heroes, although I'm sure your humility would not want us to elevate you as such. However, as you were growing up, so to speak, who were your heroes? Who were the people that brought you to take on these great causes and this particular cause?
I think I would say it started with my mother, who was in the habit of taking us to orphanages and old people's homes and places like that. And as I got older, most of my role models are ordinary people, great teachers, great carers in orphanages, great nurses where I work, as a physician. And then of course, on a bigger, scale, Rotary gave me most of my biggest heroes. When I see how much time club presidents devote to even run their clubs, it is very inspiring. And it goes like that, to the district governor, to directors, to presidents. So if you're really looking for real models that matter, there are people doing their own little things in their own little ways that adds up to the, gargantuan changes we have been able to make in the world in our 7 areas of focus, the environment being the latest one. So my first, hero actually that has set me on this path was my mother.
Wonderful. Dr. Jeffrey Rivard asks, once we have reached that eradication of polio, do we then have to continue distributing the vaccines annually? Is it something that needs to be kept up? What happens then?
Well, the previous polio endgame strategy envisages that the time will come when WHO certifies the world polio-free. In other words, at that point in time, there's no wild polio virus or any kind of polio virus circulating anywhere in the world. Then it will now be up to those countries, based on their experiences and epidemiology, to gradually stop immunizing children against the polio virus. I expect a country like the United States, for instance, that has been polio-free for decades, will be able to do it much faster than Africa because the immunization rate level is very high. The main reason why a country like the United States is immunizing their children is because of the fear of importation from a polio endemic country. And once you remove that, then they can stop immunizing earlier. But countries like Africa that have just recently been certified polio-free may need to continue immunization a little bit longer. So it'll be dependent on countries and their regions.
Thank you.
Dr. Funsho, we have time, I think, for maybe two more. The role of women in the worldwide, be it Nigeria, Pakistan, Afghanistan, and especially heading into a year that, even though Jennifer Jones does not, say that she was elected because of the first woman, it was her qualifications. It doesn't escape us that she is the first woman president of Rotary International. I think it would be beneficial, and I'd like to hear your thoughts of really talking about the value of the women's effort in this and make it part of our publicity. How can you talk to that?
I think the first thing, is to really appreciate the fact that the mothers of polio, afflicted children usually carry the burden of caring for that child. I think we should start there. And that puts a lot of urgency on us to ensure that we don't put, women in that situation. But as far as interventions are concerned, I'm glad you were in Kenya. They will have taken you around health facilities, particularly in the rural areas. Who are the carers there? They're mostly women. In Nigeria, one of the major game changers in our program are what we call VCM, community volunteers, who are engaged. And I'm proud to say that, Rotary Polio Plus Fund, pays for more than 50% of the cost of keeping these people who are in their communities, who know the people, the families, the number of children they've got, and not only ensure that they are immunized against polio, but also other childhood preventable diseases. But they also help in health promotion activities, nutrition, breastfeeding, and so on. 90% of these people are women. And one of the things the program in Nigeria does is actually to recognize this cadre of people annually with a certificate and some monetary awards. More sobering is the fact that majority of polio workers who have died in the line of duty trying to immunize our children are women, either killed, by terrorists, or are victims of, accidents, or are kidnapped and lose their lives in that process. I think I can safely say 75% of this category of people, are women. So women, have been critical to us getting to where we have gotten to today as far as polio eradication is concerned.
Thank you so much. I believe over to David at this point.
Thank you, Dr. Funsho, for your informative presentation today. It's obvious listening to your comments that this effort comes from your heart. And we thank you so much for the many lives that you've changed in your efforts and for those who've joined you to help stop polio. In appreciation for your presentation, today, a donation will be made in your name to the Rotary Foundation. Thank you, Dr. Funsho. Now,
thank you very much indeed.